Welcome back. As many of you may not know, or you may, that the month of October is also regarded as Spine Health Awareness Month. Now, Spine Health Awareness Month aims to raise awareness about the importance and the common problems associated with your spine. To help us dissect on the importance of how we should better take care of our spines, I'm joined by the secretary at the Windhoek Spine Clinic in the Roman Catholic Hospital, Andreas Ihinda. Good evening and welcome.
Good evening. Thank you for having me.
Thank you so much for being here.
Yeah.
Just to start with, perhaps you can provide, some more information about Spine Health Awareness Month and its significance. I think people know October as Cancer Awareness Month. Yeah.
So basically, last weekend I attended breast cancer awareness, which I know it's October month. And today it was like a short notice for me just to receive a call, somebody telling me about it's also a spine awareness. But just to make it short, spine is very important because it's the one that holds your posture. And I think people have to set up more awareness outside there to talk more about this kind of health issues. Not just breast cancer, but spine is the one that carries you. Mm-hmm. Is the one that makes you stand. I mean, without the spine, you just end up on the wheelchair or bedridden because it's one of the things that actually holds you up and builds your body image.
Yeah.
Yeah.
I don't think a lot of people, take, into cognizance that you have to look after your spine, that there's something about, your spine health. I think people take that into consideration and also talk to us about that and some tips for maintaining good spine health and how to better take care of ourselves in that aspect.
Yeah, I mean, taking good care of a spine, it's actually something that you will have to do to protect yourself, not to endanger yourself, because a spine is something that is more important in your body and anything can happen and you can be paralyzed. So I work for Dr. Alex van der Horst. He's an orthopedic specialist. He does spine. And I've been working there for 7 years right now. And I'm not a doctor. I'm not qualified or trained to tell you more about these things. So I'm answering on his behalf. Maintaining spine is very easy. You just have to change your daily lifestyle of living, Like spine do not like holding weight. Because the more the spine holds the weight, that's when you experience back pains, and then there are 3 levels of spine actually that you must know. There's a C-spine, a T-spine, and the lumbar spine. So what actually suffers most, this is like me answering Dr. van der Horst now on his behalf. So what affects mostly, once the spine holds too much weight, the lumbar spine suffers a lot because that's when the discs start.
Where is the lumbar spine located?
It's the lower.
The last part.
The last part. Because you got the neck is a C, and then just down next to the shoulders, in the middle is T spine, and then the L spine is on the lower side. So it's just to avoid being overweight. Change your lifestyle, control your weight, Start maybe exercising, eat healthy food.
That's interesting. I never would have thought that being overweight would affect your spine. But what are some of the other more common or most common spinal conditions? I know you can get rheumatism. Is it rheumatic in the spine as well?
And arthritis and then spondylosis, things like that. If the doctor was here, I could have tell you more in detail. But other factors that causes spine problems is let's say industrial, where you work. So if you are maybe a truck driver, or for example, you are a laborer where you lift up heavy stuffs, by the more the age you growing up and all that, it can affect your spine. Mostly the discs are the one that makes you feel like they are worn out. Some of them, there's this medical term that is called disc bulge or disc herniation, degenerative disc. So it's just the disc trying to, the spine has this vertebra and then the disc in the middle.
Right.
The spinal cord is in the middle there. So once the disc really comes out of the position where it's located and presses on your nerve, that's when you start experiencing back pain. Sometimes you get symptoms like the pain radiates down your legs and you get numbness. Sometimes it can affect with the bladder. So the best way is just to avoid heavy stuff like working at a heavy, like lifting up heavy stuff.
Right.
And yeah, things like that. In short, those are other factors. But then others, it's just spine do not like weight.
And of course, then there's the small percentage of people that are born with spinal conditions that are hereditary or genetic.
That is actually when we talk about a condition called scoliosis. Yeah, it's not something that we talked about before that has to do with the discs. Scoliosis is a condition whereby it's mostly in children. So that condition happens in children whereby the spine is not straight. It's actually like an S-type, or it's a bit skew. And then it's just that when we, as parents at home, we realize that late. You know, you see your child growing up, and then later one day you see your child is a bit askew, and that's when you start, like having those red flags, like I have to take my child for checkups. And then when the radiologist diagnose and they see that this is a scoliosis condition, then there are ways that can be treated. At my clinic, we normally get a professor from South Africa that comes by together with my boss, Dr. Alex van der Horst. They do such surgeries to correct the spine. That is, in simple terms, like when you are growing a tree, and the tree is like, you know, you put a stick or a straight metal where when the tree is growing, it also grows with that same.
Right.
Yes, basically, that's how a surgery can go. I'm not a doctor, I'm not trained, but you can understand the image that I'm telling you.
Yes, of course.
Yes.
In terms of, maintaining good spine health, you mentioned, of course, that being overweight, trying to avoid that. So losing weight, of course, number one. For somebody who is, of normal weight, who's, healthy, but does work in an environment where they have to pick up a lot of boxes, etc., or do heavy lifting of whichever nature, if they are a truck driver, what can you do? Are there stretches or exercises that you can, integrate into your daily routine to help your spine cope?
There are ways that we try to advise our patients at the clinic, whereby when we see that they are overweight. So unfortunately, when it's an overweight person, try to make sure that you exercise, eat healthy, control your sugar, diabetes, and all that. We actually refer. We have a routine, like a consecutive treatment that we normally give to our patients. You can attend physiotherapy, biokinetics, chiropractor, and those are the people that will actually, if you feel like you're not eating healthy at home, mama is always cooking pap and fish or stew.
Which is nice.
I know it's nice, but sometimes you eat healthy. Try to, the balanced diet kind of a thing. We also refer to a dietitian. And a dietitian, we give you a referral, you can go to them. They can actually teach you how, in a week, what you should have as a breakfast or lunch or dinner. And that will help you as a healthy person, because once the body is healthy, no any other illnesses will enter. But then when you start mixing things and then your body is not okay, so that's when the body is like an engine. Once somewhere there's a leakage, it's going to affect the whole mechanism.
Can you suggest any local or online resources where individuals can get additional information about spine health awareness?
I think since we are now living in the world of social media and everything, you can check more videos on online, and then so my boss is as I mentioned earlier, is a specialist, whereby he works for government hospital as well, Central Hospital. He sees patients every Wednesday. That's now locally. Every Wednesday he sees state patients, those ones who cannot afford private treatment. And also on the other hand, he works as a private doctor where I work currently for him. So if you feel like you cannot afford the consultation fee, you would like to, your back is paining, you would like to see a specialist that is specialized in the back, you can see Dr. Van der Horst at Central Hospital. You can even Google. Our number is there online. You can call me. My number is there as well. And then they will you ask and I will direct you exactly where to go. Because where I work now, definitely you need to have a medical aid because things are costly now. What if we have to send you for x-rays, MRI and all those kind of things?
Yeah,
but you feel like you cannot afford, Central Hospital is there. He works for Central Hospital. He sees anyone who cannot afford all these payments. He's a generous guy. He helps a lot.
Fantastic.
Yeah.
Thank you so much. Your final remark this evening, Andreas?
My final remarks? It was a short notice, as I said. Since you cannot say it's an awareness, spine awareness month while we're just ending the month now. You see, so I feel like next time you guys should call me earlier for me to prepare, you know. Yeah, but I'm happy, and I think with what I have shared can change somebody out there maybe that has been struggling with the back pain for so long and they don't know where to turn to.
Right.
My name is Andreas. I'm based at Roman Catholic Hospital. If you can easily access our practice, I can give you some information and then you read about it. Or if you feel like, no, consultation fee is too high, you can still proceed. I can give you a number. You call or you walk in, book an appointment and see them there.
Fantastic.
Okay.
Andreas, although it was last minute, we do appreciate your time and effort for being here and bringing some awareness to the matter. Thank you so much.
Thank you for having me.
That was Andreas Ihinda speaking to us there about Spine Health Awareness Month.